Hi, this is Dr. Janson, and today I wanted to talk to you about knee pain and orthotics, because recently we had 3 new patients come in, all with knee pain, sent from the physical therapist or their doctor because they had knee pain, and the doctor suggested that they get orthotics, which is confusing for the patient. That happened to me as well. I was working, helping a podiatrist make orthotics, and I had been surgically trained in a very high-powered surgical residency, and was sort of moonlighting, working for some extra money, helping make orthotics. And then one day, I wrenched my knee, and I really hurt my knee. So I went back to a surgeon that I used to work with. His name is Dr. Krinick. And I used to help him do arthroscopic surgery on the knee every Wednesday during my residency. So I called him up. I said, Dr. Krinick, I think I really messed up my knee. So he said, okay, no problem. He looked at me. He said, you need arthroscopic surgery on your knee, and I'll fix it for you. So then I went back to the job, and helping make the orthotics, and I said, oh, I'm going to need like 3-4 weeks off because I need surgery on my knee. And then they said, oh, well, why don't you try, we could make you orthotics. And I said, no, you don't understand. It's not my foot. It's my knee that hurts. Oh, yeah. The doctor said, I understand. But, you know, if your knee hurts, you could push the foot with orthotics and then move the knee to a different position very subtly and get off the spot that hurts. And it can really help get rid of your knee pain. And I completely did not believe that to be true. But, you know, I didn't want to cause waves, and I wanted time off, so I just said, oh, okay, make me a pair of orthotics, that's fine. And then a few weeks after I got the orthotics, I was running down the stairs, a little late for work. I'm looking like running down the stairs, and I stopped. I said, wow, I haven't run downstairs in over a year because my knee hurt so bad. I said, maybe these orthotics are working to help me. And to this day, I never had that surgery. It's like 30 years later, 40 years later, whatever. So it's a long time ago. So that was my introduction to orthotics, and began my pathway of working with orthotics. And over the years, I got more and more away from doing foot surgery and more towards doing orthotics, where one day about 10 years ago, I gave up doing foot surgery altogether, because every podiatrist does foot surgery, but no one is left making orthotics by hand anymore, not podiatrists. Anyways, so this week I had 3 new patients coming in with knee pain, and just like me, I'm so sympathetic to it, because the patient who's been told, you know, by the doctor, which is the physical therapist or the orthopedist, saying, well, I've sent patients before with knee pain, you know, to see if orthotics could help. And then, you know, if they don't, you could always have surgery, but why don't you see if orthotics could help? So 2 of the patients had a flexible flat foot. And what that is the foot is very flat. So it's going away from the body. So it puts a lot of stress on the knee, on the inside of the knee. So the idea of orthotics is just to get the foot back under the knee. So instead of the knee being pushed this way and it'll pull on that inside, it really hurts there, to put the foot back under there and reposition and straighten out the femur to the tibia so that the knee is not under so much stress. So I had 2 flexible flat foots. And the other one was interesting. It was a young man. Actually, the patient was only like 25 years old with knee pain, left knee pain, a meniscal injury to the knee as well. And it was interesting because the young guy had a very curved tibia, and that's called tibial varum. So he was like the opposite of the 2 other patients. So their force on their leg was going externally, and the young fella's foot was going internally. So I'll actually do to the young fellow's orthotics the opposite of what I'll do to the other 2, which is to get the foot, you know, come to the outside and get under the knee. And then what I do is I'll have the patient come back in a month, and then maybe in 2 months, to make sure it's working, watch the patient walk, and make sure I'm getting rid of the pain. And many, many years ago, Another funny thing that happened was a woman told me when I was first starting out, she said, you know, I once had a podiatrist who made me orthotics by hand. And this was probably in the 50s, you know, the person was telling me this like in the early 90s. I had a podiatrist who made orthotics by hand, and I would go in every few weeks or every month I would go in. And after a month, the knee pain was better. And then he adjusted the orthotics. He played with them in the workshop. And then the knee pain moved into the middle. But it was a little bit less. And then I went back and it moved to the end. And then another time I went for an adjustment and the pain was gone. And I could tell it was just every time he did the adjustment, the pain was moving into a different place until it was gone completely. And that art form, which is the adjustment of orthotics like that, repetitive adjustments to you know, see if you can get it a little bit better, tweaking the orthotic, is something that's almost a dead art. There's still a few podiatrists that do that, adjusting orthotics. They don't make them by hand, but they do adjust them. But there's very few. I know of maybe 10 podiatrists that have a workshop in their office to fix orthotics or to play with orthotics. So there still are some. But that's the real art of orthotics, is adjusting them, especially with knee pain, which is very fun to work with the patients. They come in very skeptical. My doctor is making me come. My husband is making me come here, and my husband is your patient. Oh, I had that today too. My husband is your patient. You know, what brings you in today? My husband. I'm like, oh, okay. And so they turn from skeptical to, you know, being really thankful and appreciative because their knee pain is gone. So that's how orthotics can help you with knee pain. So hopefully you found that to be helpful. Please like and subscribe if you haven't already. And see you in the next video.